Chapter 19, The Heart, Part 2. So we've got the systemic circulation for the body as a whole. We've got the pulmonary circulation for getting the oxygen we need. What about the heart itself? Doesn't the heart need its own oxygen? It is a living organ after all. And it turns out the answer to that is yes, it does. And this is called coronary circulation. So coronary circulation is the blood vessels carrying blood to and from the heart itself. Now, the beginning of coronary circulation occurs right at the very base of the ascending aorta. So almost as soon as the blood leaves the left ventricle and enters the ascending aorta, there are these two blood vessels, the right coronary artery and the left coronary artery. They branch directly off of the ascending aorta, carrying blood nice and oxygenated to the heart. The right coronary artery will split, giving us the marginal branch, and also will wrap around to give us the posterior interventricular branch. The left coronary artery will split into the circumflex branch, going around the left side and toward the back, and will also form in front the anterior interventricular branch. So here is the anterior interventricular branch. Again, these are all arteries carrying blood to the heart organ. Here's the posterior backside of the heart. So here's where you see the posterior interventricular branch that was coming off of the right coronary artery. Branches will get smaller and smaller, giving us eventually blood capillaries, and blood will start to return. That's now deoxygenated, leaving the heart organ to return to the right atrium. So that means the blood has to be carried by veins, specifically the cardiac veins. So this vein here is all the great cardiac veins. So going up the front and wrapping around the left side, that is all great cardiac vein. This smaller vein here going on the right side and wrapping around, that is the small cardiac vein. Here again is that posterior view. So here's part of the small cardiac vein, here's part of the great cardiac vein, and then down here is the middle cardiac vein. All three of these cardiac veins then empty into the coronary sinus. So this vessel here is the coronary sinus, and that is a type of vein, and it empties into the right atrium so that all the blood that was traveling through from the heart will end up back in the right atrium. Coronary circulation disorders. There's myocardial ischemia. This is when there's a reduced blood flow to the heart, specifically to the myocardium, the muscle tissue of the heart. This could be caused by a partial blockage or some other sort of damage to arteries. It causes low blood oxygen levels, also known as hypoxia. This will make the cardiac muscles cells weaker because they're not generating enough energy to function efficiently. It can also lead to pain, and pain in the chest is known as angina pectoris. Another problem could be a myocardial infarction. Myocardial infarction, that is a heart attack. Heart attack only occurs if there's complete blockage of a major coronary artery. So if a large coronary artery is completely blocked and no blood is flowing through it, then the person is going to have a heart attack. The area of the heart is not getting blood at all. The cardiac tissue in that area will start to die off. The heart will become weaker, and the person could die pretty quickly, could potentially die. And of course, there's also pain associated with a myocardial infarction, again, collectively known as angina pectoris. Normally, when one common pain symptom in men especially is a pain in the left side of the chest, as well as a shooting pain in the left arm. So anyone experiencing pain in both the left side of their chest and their left arm, probably having a heart attack and need to go to the emergency room. Unfortunately, that's not always the case. Pain symptoms can vary, especially in women, so it can be, that's not the absolute thing to expect if someone's having a heart attack. They might feel other pains in the chest or abdomen that actually are a sign of heart attack. All right, moving on to the cardiac conducting system. Cardiac conducting system is the system that generates an electric signal within the heart itself to stimulate the heart's beating. So the heart generates its own electric signal to cause it to beat. This all starts in what's known as the sinoatrial node. Sinoatrial node, a structure in the wall of the right atrium. It generates the electric signal that then spreads out to both sides of the heart's atria, so both right and left atria. And this causes the atria to contract in unison. So the sinoatrial node, also sometimes called the natural pacemaker, if for some reason it is not working appropriately, people can have an artificial pacemaker put in to supplement the sinoatrial node to cause the cardiac conducting system to initiate properly. The electric current that traveled to both the atria will also travel down the interventricular septum. And when it reaches the apex of the heart, the signal will then go to the right and left ventricles, and this causes the ventricles to contract. So again, first the current's generated in the sinoatrial node, spreads to the atria, they contract, and then the signal continues down the interventricular branch and then spreads to the ventricles and they contract. So there's a slight delay between when the atria contract and when the ventricles contract. And here is a video of a heart that has been removed from someone who died and is going to be used as a donor heart. And there's this machine they connected to. So here's the heart being connected to the machine. That's blood that's flowing. And so this will allow blood to enter the heart. And as you can see, as soon as blood is filling the atria, the heart begins to beat. No brain is needed for a heart to beat. Just needs blood filling the atria. Pretty wild, huh? All right, the heart makes two sounds that you can be heard with the stethoscope, a lub and a dub. Actually, someone really well trained can actually distinguish the sounds of each valve closing. So the lub is the sound of the atrioventricular valves closing. So that's when the ventricle starts to contract, the tricuspid, bicuspid valves close, that's the lub. And then the dub is the sound of the semilunar valves closing. So when the ventricle relaxes and the semilunar valves close, that gives us the dub, lub dub. Coronary artery disease. Coronary artery disease is when fatty material develops and builds up within coronary arteries. This is called atherosclerotic plaques forming within the arteries. This then narrows the space within the arteries, making it possible for blood flow to be reduced so that less blood makes it to the myocardium, makes it to the muscle tissue in the heart. This could cause chronic chest pain because the heart's not getting enough oxygen and nutrients. The narrowing of the artery also makes it more likely that a person will have a blockage in that artery. So if someone has an abnormal blood clot that happens to arrive and block off that artery, that would then potentially lead to a myocardial infarction, aka a heart attack, because again, you don't get a heart attack unless you have complete blockage of an important coronary artery. Coronary artery disease can be treated by a few different techniques. One is coronary artery bypass surgery. This is where they open up the chest cavity and then they take blood vessels, arteries from other parts of the body and use them to route blood around where the blockage is. So they're bypassing the blockage. They're using arteries to bypass the blockage, coronary artery bypass surgery. And so if someone tells you they had a triple bypass, that means they had 3 arteries taken from somewhere else in their body and attached to their heart to reroute blood. Another approach that's out there is called angioplasty. This is where they take a thin tube and weave it through the various blood vessels in the body until it gets to the coronary arteries, specifically the coronary artery that's developed that atherosclerotic plaque. And then to try to widen that space up, the end of the tube will spread and expand, squishing the atherosclerotic plaque onto the walls, thereby opening up that space so that blood can flow more efficiently, and it's less likely that a blood clot would lead to a heart attack. And that is it for this lecture.